cool thing about the X10 is it is like the perfect therapist that knows exactly how to move your leg and does it the same way every time, and you could increase that as much or as little as you want. As far as I'm concerned, it's so much superior than trying to do something yourself or even have a physical therapist do it for you. My name is Bob, and I have a real active life. I was in executive retail management, which was on my feet 12 or 14 hours a day for 30 years. And I'm still an avid walker. In fact, I like to get a 15-minute mile out 4 miles a day. So I've always been very active. I experienced a lot of knee pain, a little bit of arthritis, and so I got cortisone shots regularly in my knees. When I got a hold of X10 and I told them I was having the manipulation surgery, they actually timed it. And sure enough, I was home around 12:30, 1 o'clock, and the machine came within about 90 minutes of the time I was home. So on the day that I had the manipulation surgery, that evening, I was already on the X10. Now the cool thing about it was, the first run on the X10, I got an 80 or an 85 flexation right off the bat from the surgery. So I mean, I had improved my numbers almost 20 degrees. And I was pretty stinking excited about that. Well, there was a little bit of discomfort for the first few days, but that was just something that would be normal because my muscles weren't used to getting that kind of range of motion. And it didn't take long where that was gone. Actually, it started feeling good because the muscles were remembering what it felt like to have that stretch to it. And so pretty soon it was very therapeutic. On the extension, it was 0 degree, which was perfect. It's as far as the machine will go. And on my flexation, it was 112. And I got that every time I went on there, 112, which is amazing when I stopped to think that I actually started out at 55 and then 68 was the farthest I could get, and I ended up doing 112. Both surgeons, Dr. Perdue and Dr. Urquhart, they know I'm sitting there singing the praises of the X10, and that's no joke, because I have no doubt that's going to speed up recovery and I'll be better than I've probably been in years. So I would absolutely insist on it. So what am I doing next summer? What I do know I'm going to be doing is back to walking 15-minute miles, 4 miles a day. I'm going to go back to doing that. It's a whole lot better than it was when I was on a walker 2.5, 3 months ago. So I'm pretty happy.